गुड मॉर्निंग समस्त मोर नमस्कार कहूची म्यूट करते आज आमर जो कोविड-19 सेकेंड राउंड ट्रेनिंग रा आज फर्स्ट डे एठी जेते आमर अछंती पार्टिसिपेंट मो समस्त को वेलकम करूजी। आज आम संगे अछंती डायरेक्टर मिमसर डीन प्रिंसिपल एंड मिमसर एंड आमर सर्वोपरि अछंती आमर कैपेसिटी कोविड जो स्टेट टीम रो हमको जो माने अछंती मार्गदर्शक ता भितरु हमको आज अनुगार मैडम जॉइन करिवार थिला से आसनांती किंतु आ भितर केतोळा सी जॉइन करिवे एवं आम संगे अछंती सर बीएस पुनिया आईएएस जे के हायर एजुकेशन रो चार्ज रे अछंती सर आज से भी हमर कैपेसिटी बिल्डिंग टीम रो जने मेंबर एक्टिव मेंबर एंड तांकर बहुत अवदान अछि हमर ए जो ट्रेनिंग सब हमें करूछु मेडिकल ऑफिसर हो स्टाफ नर्स हो से मानकर बहुत अवदान अछि। सर आई वेलकम यू टू दिस मीटिंग with us Professor Sadhucharan Panda and HOD Community Medicine भीमसार जे कि ए ट्रेनिंग रो मार्गदर्शक एवं जो हमारा भीमसार कॉलेज ऑफ नर्सिंग रो जो ट्रेनिंग मॉड्यूल तैयारी हेची तार डिफरेंट कंपोनेंट रे से सहाय्य करिसंदी एवं तार वेरिफिकेशन एवं तार प्रिपरेशन रे से हमकु सहाय्य करछंदी। जेहेतु आपण माने जानिथिबे आम वर्तमान हमर ओडिसा रे केवल नुहे सारा भारत रे कोविड-19 रो सेकेंड सर्ज बा द्वितीय जो पीक हमर आरंभ होई जाईची एवं ताकुई नजर रे रखी पुणी कोविड उपरे रिओरिएंटेशन करेबार हमर ए ट्रेनिंग रो आज लक्ष्य 2020 रे एई कोविड उपरे डिफरेंट एस्पेक्ट रे बेसिक कोविड ट्रेनिंग टू आरंभ करी आईसीयू मैनेजमेंट हाउ टू हैंडल अ पेशेंट विथ वेंटिलेटर जो स्पेसिफिकेशन थिला हमरो हमें ता उपरे प्राय 5टी ट्रेनिंग शेड्यूल करिथिलु एवं हजार हजार संख्या रे आपण माने जोग देइथिले। मो भाबुची गला वर्ष रो ट्रेनिंग रो किछिटा फल हमें पाइछु एवं मोते बहुत खुशी लागिला जेते बेले जेते हेल्थ केयर पर्सनल हमें इंटरैक्ट करथिलु समस्ते मुक्त कंठरे स्वीकार करथिले जे कोविड-19 जो सक्सेसफुल मैनेजमेंट हमें गला वर्ष करिथिलु सेइथिरे हमर नर्सिंग ऑफिसर मानकर भूमिका बहुत गुरुत्वपूर्ण थिला एवं मन प्राण दे समस्त नर्सिंग ऑफिसर आप्राण उद्यम करिथिले जे किपरि हमें निरंतर भाव रे एई कोविड-19 पेशेंट मानकु हमर सेवा जोगेई पारिथिबु। जो स्टाफ नर्स माने हमर जोग देइथिले एवं एई सेवा रे निज दिन राति एक करी कोविड रोगी मानकर चिकित्सा रे हमकु सहयोग करथिले। मु समस्त को धन्यवाद दउची एवं आशा करूची जे से माने जेपरि काम करिथिले एवं जो डेडिकेशन से माने देखै जंदी गला वर्ष एई वर्ष रो भी हमें सेही डेडिकेशन से सेम हमर निजर निस्वार्थपर सेवा को हमें आगे नबा एवं ए थर रे जो हमर समाज नुहे हमर प्रदेश नुहे हमर देश समग्र पृथ्वी जो कोविड-19 जो तांडव लीला हम आगे आज उभा हेची सेथिरे गोटे कोविड रोगी को आमे जे सुस्थ करी घर को पठै परिबा तार जो खुशी सेथिरे आमे सहयोग करिबा एवं हमर ए जो ट्रेनिंग ए गोटे हमर छोट प्रयास जे एई दिगरे आपण माने किपरि को सामर्थ्य लाभ करिवे एवं आपण को हमें केमती कोविड-19 जे कोनोसी लेटेस्ट अपडेट हमें किपरि आपण को जणै परिबो सेथिरे हमर एटा गोटे छुटिया प्रयास एवं मो आउथरे कहबी जे एटा गोटे हमर ट्रेनिंग एठी सरीबो नाही हमें आ परे आईसीयू मैनेजमेंट वेंटिलेशन वेंटिलेटर केमती हमें हैंडल करिबा एवं ऑक्सीजन सैचुरेशन को लेवल रे केते बेले हमें करिबा से सब ट्रेनिंग भी हमें प्लान करिछु एवं एम्स कॉलेज ऑफ नर्सिंग बड़ी एक प्रख्यात अनुष्ठान एथिरे हमकु सहयोग करिवे एवं हमें ए ट्रेनिंग करिया को समर्थ हो। मु वर्तमान पुनिया सर जे आम संगे अछंती श्री बीएस पुनिया आईएएस सर को किछि रिक्वेस्ट करबी जे आपण मान को मोटिवेट करबा को से किछि आपण को कहबे। थैंक यू।
थैंक यू मैडम। नमस्कार समस्त को मोर बहुत बहुत नमस्कार। प्रिंसिपल सर अछंती, विन सर, फैकल्टी सीनियर फैकल्टी मेंबर्स अछंती, हमर डायरेक्टर मैडम अछंती, आ समस्त स्टाफ मेंबर जो माने जॉइन करछंती ताको बहुत बहुत स्वागत जणाउची, धन्यवाद जणाउची। आपण मान समस्त जानती जे हमर नर्सिंग स्टाफ होचंती बैकबोन ऑफ द एंटायर हेल्थ सिस्टम। आ एते दिन धरी कि आपण माने बहुत सेवा करछंती लोकों को। निजर भी बहुत असुविधा थाई कि एते लंबा माने बहुत लॉन्ग ड्यूरेशन हे गला तापरे भी आपनकर जो मोटिवेशन अछि, आपनकर जो सेवा भावना अछि सेटा बढ़ी की जाउची, जेटा से समस्त को पई मानवता पई एटा बहुत भलो माने संदेश अछि जे विदिन आपनकर जते कैपेसिटी थाई कि ताटु बाहरे आपण माने समस्त सेवा करछंती। एही हिसाब रे आपनकर जदी मो कहिबी जेते भी आपनको धन्यवाद देवा सेटा तो बहुत कम, किंतु जेते बेले भी आमे सेवा करबा को चाहूची कि का को आमे हेल्प करबा को चाहूची तले हमरो प्रथमे होची जे आमे निजे जदी संबल थिबो वी कैन हेल्प अदर्स। तो संबल कोन हमरो मेंटली इमोशनली फिजिकली आमे जदी ठीक थिबु तले आमे अन्य मान को हेल्प करि परिबु। और तारे गोटे आउ माने बहुत गुरुत्वपूर्ण एलिमेंट अछि सेटा अछि स्किल नॉलेज। जदी सेटा नथिबो आमे भलो से लोकंकर सेवा करि परिबा नहीं। सेटा को बारंबार जेहेतु एटा नुआ पेंडेमिक आमे से विषय रे बेसी किछि जान नथिलु, एटा इवोल्व होउची एबे भी एबे सेकंड वेव रे भी किछि किछि नुआ जिंसो भारीची। तो सबु बेले हमको वी हैव टू कीप आवरसेल्फ अपडेट। हम धन्यवाद देबी जे हमर डायरेक्टर नर्सिंग से बहुत आपण मानकर एक्सटेंसिव ट्रेनिंग पे आगु भी बहुत स्टेप नहीं थिले। तापरे हमर जते मेडिकल कॉलेज अछंती एम्स अछि समस्ते हमको हेल्प करछंती, आपण मानको को मोटिवेट करछंती, आपण मानको को राइट स्किल दउछंती। सेति पई आपण मानको मु पुणी रिक्वेस्ट करिबी जे आपण जते बेले बेटा ट्रेनिंग होउची ताको सीरियस नियंतु। आउ जते जते नुआ हमर ए पेंडेमिक पई जते प्रोटोकॉल भारुची किंबा अन्य जो ताकर सेवा पई कोविड मैनेजमेंट पई जते नुआ जिंस आसुची आमे ताको ए जो ट्रेनिंग कराउची ता बाद भी मु आमे जानिचु जे आपण मानकर भी निजे ग्रुप अछि, आपण माने भी आपणकर संग साथी कि सेते व्हाट्सएप रे कि अन्य अन्य आसुची। गोटे रिक्वेस्ट थिबो जे आपण ऑथेंटिक इंफॉर्मेशन जते बेले ट्रेनिंग पई किंबा अन्य अन्य जो आसुची प्लीज वेरीफाई दैट बिफोर एग्जीक्यूटिंग। आउ सेति पई हमरो जो डायरेक्टरेट तरफ रु आउ गुडा मेडिकल कॉलेज अछि से तरफ रु जो ट्रेनिंग दिया जाउची ताको आपण जॉइन करंतु। आउ आपणकर जो अन्य समस्ते तो गोटे थर आसी परिबे नहीं, एबे बहुत आपण मानको वर्क प्रेशर अछि तारे भी हमें समय बाहर करी कि निजे को अपडेट करबा निहाती दरकार अछि। सेति पई ए जो जूम ट्रेनिंग रे बहुत हमरो स्टाफ मेंबर्स आसी पार नथिबे बिकॉज़ ऑफ ड्यूटी। मो रिक्वेस्ट करिबी जे हमरो YouTube चैनल अछि, एबे भी एटा जदी आपण देखिबे ए ट्रेनिंग भी YouTube चैनल रे लाइव अछि। आउ ता परे भी सेटा हमरो हेल्थ ओडिसा बोली कि गोटे चैनल अछि, सेथिरे आपण एई सबु जेते ट्रेनिंग होउची आपण को आगु जेते ट्रेनिंग हेतिला सबु वीडियो गुडा सेठी अछि, एटा भी रहिबो। तो सेटा मो रिक्वेस्ट करिबी समस्तों को जे आपण माने समस्तों को संगरे से लिंक ता शेयर करंतु। आमे भी आपण को चैट बॉक्स एठी पकाइबो। आपण को अन्य माने जो जूम रे कंफर्टेबल नाही किंबा समय नाही किंबा नेटवर्क ताको सपोर्ट करू नहीं फॉर एट द टाइम ऑफ द कंडक्ट ऑफ ट्रेनिंग। मो रिक्वेस्ट करिबी कि जे आपणकर जेते बेले भी समय थिबो जेते बेले भी सुविधा थिबो से ट्रेनिंग गुडा को आपण सेठी आपण देखि परिबे। और एटा निहाती दरकार अछि। सेति पई बारंबार चेष्टा कराउची जे जोटा भी अपडेट अछि ए पेंडेमिक को नै कि कोविड को नै कि तार मैनेजमेंट को नै कि सेति पई आपण अपडेट रखंतु। आ विशेष आपणकर मु समय नेबिनी। समस्तों को बहुत बहुत धन्यवाद। आशा करिबी जे निजे ठीक से रहंतु और अन्य मानकर जेमती आपण सेवा करछंती सेटा को कंटिन्यू रखंतु। आपण को बहुत बहुत धन्यवाद। जय हिंद।
सर Sir, Professor May. Okay, sir. Now I will request Sucharan Panda, Professor Community Medicine, to say a few words. Sir has been the mainstay of this training. He is the facilitator who has gone through the contents of the training, has vetted them, and then only this PPT has been prepared. Thank you, sir. Please join the meeting and say a few words.
Welcome, sir.
Yes, welcome all of you, and I welcome especially the leaders in the healthcare delivery system of Odisha who are leading from the front and from every corner, every time. All the big leaders at Bhubaneswar were moving to different places also to gear up, to motivate the people, and Director Nursing, who has actually started this venture, and I am very indebted to her to be a part of this academic activity. So now I will be telling something.
Is there any problem? Director Madam? Aswida Hele.
So good morning, sir. I think sir has lost the internet connection. So we'll go to the principal, ma'am. Principal Burla, ma'am, please join.
Principal College of Nursing, Kurla. Ma'am, please join.
Hello.
Yes, sir. You're audible.
Yes, sir.
Audible now. Sir, kuhantu.
So actually, as far as our state is concerned, of course, we don't have any dearth of oxygen. It is rather we are supplying to other states. But the challenges now, as Punya sir has told rightly, that the nursing community or the nurses are the backbone of our healthcare delivery system. They actually face few challenges, no doubt. There is workload, there is constant and continuous work has to be done. And against all this backdrop, it is high time for them to solve the ethical dilemma, that is personal preferences, professional preferences. So it is because this is a war against the invisible enemy, and it is warlike situation, your warriors. So here we have to be altruistic, have prefer sacrifice and selfless service, and then only the COVID-19 problem can be tackled. So against all these, during this surge, whatever challenges are there, whatever problems are there, it can be met by the nursing community, by their compassionate care, by empathy, and more or so, there should be some training should be given to them to how to communicate, how to give solace to the bereaved family, and how to provide this communication, and how to give psychosocial support to the family. And there is of course a need for those who are surviving in the ICU, they should be followed up and continuous support should be given to them, because continuum of care is the only answer to this. So some steps should be taken in this regard. And I wish this e-learning will make our nurses more enthusiastic, more energetic, more engaged, and they should do the work with more empathy and sacrifice. Wish all the nurses the best, and we express our gratitude for their constant selfless service. And government rightly to support these nurses, this is one step. The training, ongoing continuous learning will increase their skill and knowledge, and of course the attitude and communication will make them more competent to do their best to fight against this calamity or disaster. And now they are the sisters, they will fight against this sinister. And at last, I quote the Florence Nightingale is told, what can you do if you will have fear? So we should remove any sort of fear, anxiety, and fight against this COVID-19 and do the best for the community. It is our time to do the best for the community and keeping aside everything behind. And the nurses have proved it time and again across the globe. And we hope they will do it again, and best wishes again to them. And I express my gratitude to Director of Nursing and Government of Odisha for giving me an opportunity to share these thoughts. Thank you. Thank you. Thank you. Smita. Smita. I'm not audible, I think.
Sir, you are very much audible, sir. I think they will take a few seconds to just. Sir.
I've just completed. Okay. Sir.
Thank you, sir. Thank you for your motivating words, kind words. I hope next speaker is ready with the. I think next speaker is Principal, Madam.
Good morning, everybody. Honorable Principal Secretary and Department of Women and Child Welfare Department, Honorable Health Secretary, respected Director of Nursing Madam, respected Director Bhim Sir, respected Superintendent Sir, respected Professor Dr. Sadhucharan Panda Sir, Department of Community Medicine, and State Nursing Consultant Bala Sir, and all faculties of College of Nursing, Bhim Sir Burla, and all participants present in virtual platform. Today is the happiest and auspicious day of our college. Before some days, Director of Nursing Madam called me and said if I will do a webinar on COVID-19 management and told me to give my opinion. After that, I discussed with my faculties regarding this and finally confirmed to ma'am. From that day, under the guidance of Director of Nursing Madam, Sadhu Sir and Bala Sir, we prepared this very outdated webinar accordingly. All faculties of our college, all resource persons gave their continuous effort, and a big technical support from Chinmay Sir and Sunil Sir have enabled to complete our work. This is first webinar of our college. Thank you everybody for your support and guidance. Thank you.
A warm greetings to one and all present here in this virtual platform. Presently, the frontline warriors are fighting against the hidden coronavirus all over the world, and the second wave of COVID-19 is going on in our country. As the virus is hidden and it is repeatedly changing its trend, the war is challenging for all the healthcare personnel, and it is very difficult to control the infection. Among those health workers, the nursing personnel are the backbone of this ongoing war. So, COVID-19 is the challenges for nurses. I, Chinmay Chaudhary, tutor, College of Nursing, Visar Burla, going to introduce you about COVID-19 second wave. And my topic is limited to identification, severity, and lab diagnosis of COVID-19 infection, as time is also limited. As we all know, COVID-19 is a highly contagious disease and mainly transmitted person to person through droplet infection. At first, only more than 60 years population were at risk, but now the second wave of COVID-19 is affecting both youths and children rapidly. Majority will be seen in the younger generation. Till date, there is no definitive treatment. Only supportive care is being provided to the COVID-19 positive cases. 10 to 15% of the total positive cases need hospitalization, and 5% of total positive cases require intensive care unit admission. And the mortality rate in our Odisha is 0.52%, and in our India that is 1.5%. As in the COVID-19 second wave, there is significant need to increase ICU beds, for which increased number of manpower is also required, mainly the nursing personnel, because the nursing personnel's role is pivotal. They monitor the patients, then early detection of warning signs, then preventing preventable complications, then even counseling and psychological support is being provided to their family members. Now we will discuss about how we can define a case, or to whom we will say a confirmed case or a suspect case. Okay, any person who have arrived from a high load area and presence of any symptoms in last 14 days will be called as a suspect case. High load area means where in an area majority of COVID-19 positive cases are found. Okay, and next, any person having contact with a laboratory confirmed case and having symptoms will be said as suspect case, or any healthcare personnel having symptoms of COVID-19, or any hospitalized patient having symptoms of the symptoms like fever and cough and or shortness of breathing. Then any person having direct and high risk contacts without any symptoms or asymptomatic direct and high risk contacts are also suspect cases. Okay, these five statements will define a suspect case. The next, to whom we will say confirmed case, the person with laboratory confirmation of COVID-19 infection, irrespective of any clinical signs and symptoms, will be said as a confirmed case. Then we will discuss about the mode of transmission. There are various mode of transmission, and the first mode is the droplet transmission. It is transmitted human to human via sneezing, coughing, talking. Then next, aerosol generating. Aerosol is formed during the procedures like suctioning, then intubation, or any surgical or dental procedures. Then gastrointestinal secretions like in feces, saliva, anal secretions. Then in fomites, contaminated surfaces like mobile phones, utensils, clothing, etc. And in sexually transmitted, as virus is present in semen and other body fluids like blood, urine, tears. And it can also transmit from mother to child during interpartum period. And these three sexually transmitted other body fluids and mother and child, these are having low prevalence of transmission. To whom we will say as high risk population or high risk group, the age more than 60 years are high risk, or the comorbid diseases like cardiovascular, diabetes mellitus, hypertension, chronic lung, kidney or liver disease, or CVA, or any immunocompromised states like HIV/AIDS patients or organ transplanted patients or cancer patients, or obesity. Obesity is also high risk group because obesity worsens outcomes from COVID-19. People who are overweight may triple the risk of hospitalization due to COVID-19 infection. Obesity decreases lung capacity and make ventilation more difficult for the person. Then happy hypoxia. Youngsters may have happy hypoxia. Happy hypoxia means there will be no breathlessness, there will be no symptoms of breathlessness or any other symptoms till the oxygen saturation level decreases to 80%. Okay, after decreasing the 80%, the patient will have severe illness with COVID-19. So he or she needs the. Anyone can get sick with COVID-19 and become seriously ill or die at any age. Then next we will discuss about the common symptoms seen in COVID-19 infection. The four most common symptoms are fever, sore throat, dry cough, myalgia, dyspnea, and in these less common symptoms are seen as loss of taste or smell, nasal congestion, conjunctivitis, headache, muscle or joint pain, skin rash, nausea or vomiting, diarrhea, chills or dizziness. And in severe COVID-19 disease, the symptoms are shortness of breath, hypoxia, loss of appetite, confusion, persistent pain or pressure in the chest, high temperature that is more than 38 degrees Celsius, And in less common symptoms of severe disease, we will find irritability, confusion, reduced consciousness. There may be or may not be seizure, anxiety, depression, sleep disorders, strokes, encephalitis, or nerve damage. Now we will discuss about the clinical severity of COVID-19, how we can distinguish a patient with COVID-19 infection, that the patient is having mild illness or moderate illness or severe illness. First we will discuss the mild illness, that is uncomplicated illness. In this, patient may features with non-specific symptoms such as fever, cough, sore throat, nasal congestion, malaise, headache, and without shortness of breathing or hypoxia. And the elderly and immunosuppressed may present with atypical symptoms. And this type of patients doesn't require hospitalization. Next, in moderate illness or mild pneumonia, patient will have pneumonia, but there will be no signs of severe pneumonia, and the respiratory rate will be more than equal to 24 breaths per minute, and patient have breathlessness, and the oxygen saturation level will be 90% to 93% on room air. And in children with non-severe pneumonia has cough or difficulty in breathing or fast breathing. Fast breathing can be defined in less than 2 months of child is respiration rate will be more than equal to 16 breaths per minute, and in 2 to 11 months respiration rate will be more than equal to 15 breaths per minute, and in 1 to 5 years of children we will find more than equal to 40 breaths per minute. Then next, in severe COVID-19 illness, we will find several diseases or complications that are severe pneumonia, then acute respiratory distress syndrome, that is ARDS, then sepsis, multi-organ dysfunction syndrome, MODS, then septic shock, then multi-system inflammatory syndrome in children, MISC. We will discuss one by one. First, in severe pneumonia, the adolescent or adult patient may present the features like fever or suspected respiratory infection plus one of the following, that is respiratory rate more than 30 breaths per minute, or severe respiratory distress, or SpO2 level decreases 90% on room air. And in children we will find cough or shortness of breathing plus one of the following, that is central cyanosis, or SpO2 level decreases to 90% on room air, or severe respiratory distress, for example grunting, chest injury, or inability to breastfeed or drink, lethargy or unconsciousness or convulsions, or fast breathing. In acute respiratory distress syndrome, the onset of the patient will be new or worsening respiratory symptoms within 1 week of non-clinical manifestation. And in chest imaging, we will find bilateral opacities, not fully explained by effusion, or lobar or lung collapse, or any nodules. Then the origin of edema will be respiratory failure, not fully explained by cardiac failure or fluid. Then sepsis. In adults, it is life-threatening organ dysfunction, and clinical manifestation will be altered mental status, difficulty or fast breathing, then low oxygen saturation, reduced urine output, fast heart rate, weak pulse, cold extremities, or low blood pressure. Then skin molting or laboratory evidence of coagulopathy, thrombocytopenia, acidosis, high lactate level, or hyperbilirubinemia, and there will be low WBC count. And in children, we will find suspected or proven infection, and there will be more than or equal to 2 systematic inflammatory response syndrome, that is SIRS criteria, of which one must be abnormal temperature or white blood cell count. It is the development of potentially reversible physiologic abnormalities involving 2 or more organ systems, and it is life-threatening and it requires ICU. and it affects the organs like lung, kidney, heart, cardiovascular system, GI system, hepatic, neurologic, hematologic, immunologic, or endocrine systems. Then in septic shock, the adults may have persisting hypotension less than 2 micromole per liter. And in children, hypotension or 2 3 of the following: altered mental state, bradycardia or tachycardia, prolonged capillary refill, that is more than pulses, tachypnea, molted skin or petechial or purpuric rash, increased lactate or oliguria, hyperthermia or hypothermia. Then inflammation, pain in the stomach, skin rash, Then we will discuss about the laboratory diagnosis of COVID-19 infection or coronavirus. The preferred sampling is done through throat and in alternate nasopharyngeal swab or bronchoalveolar lavage or endotracheal aspirate is done. After the collection of the sample is to be mixed with the viral transport medium and transported through cold chain for in this picture you can see sample vials and virus transport medium. After collection of the sample, it is mixed with this BTM and then wrapped with the cotton or tissue paper. Paraffin is used to cover or sealing this. Then it is sealed with cello tape. Then it is kept in the 50 ml centrifuge tube or any plastic container or ziplock pouch or cryo box. After that, it is kept in the outer container with hard frozen gel packs. Then it is sent to the laboratory for further testing with proper labeling of the sample. So, what are the general guidelines for sampling? Sampling should be done by trained professionals using proper PPE with latex-free purple nitrile gloves while collecting the sample from the patient. And infection prevention control should be maintained strictly, and there should not be entry to visitors or attendants to prevent cross infections. Then, after collection of the swab, expression and online requisition through sample referral form and creation of sample referral ID of each specimen. Then after the procedure, now we will discuss about the respiratory specimen collection methods. First, in lower respiratory tract, through bronchoalveolar lavage or tract It should be transport medium. After collection of the sample, it is mixed with this BTM and then wrapped with the cotton or tissue paper. Then after wrapping, paraffin is used to cover or sealing this. Then it is sealed with cello tape. Then it is kept in the 50 ml centrifuge tube or any plastic container or ziplock pouch or cryo box. After that, it is kept in the outer container with hard frozen gel packs. Then it is sent to the laboratory for further testing with proper labeling of the sample. So, what are the general guidelines for sampling? Sampling should be done by trained professionals using proper PPE with latex-free purple nitrile gloves while collecting the sample from the patient. And infection prevention control should be maintained strictly, and there should not be entry to visitors or attendants to prevent cross-infections. Then, after collection of the swab, it should be labeled and triple layer packed, and it should be spill proof transportation. And online requisition through sample referral form and creation of sample referral ID of each specimen. Then after the procedure, proper disposal of all waste generated. Now we will discuss about the respiratory specimen collection methods. First, in lower respiratory tract, through bronchoalveolar lavage or tracheal aspirate, we can collect the sputum. Collect 2 to 3 ml into a sterile leak-proof screw-cap sputum collection cup or sterile dry container. Then after, it should be sent to the laboratory with proper procedure. Then in upper respiratory tract, there are two methods, that is nasopharyngeal swab method and another is your oropharyngeal swab method. In nasopharyngeal swab, tilt patient's head back 70 degree, then insert flexible swab through the nares parallel to the palate until resistance is encountered or the distance is equivalent to that from the ear to nostril of the patient. Gently rub and roll the swab. Leave the swab in place for several seconds to absorb secretion before removing. Okay. And in oropharyngeal swab, tilt patient back 70 degree, then rub the swab over both tonsillar pillars and posterior oropharynx. Avoid touching tongue, teeth, gum. Okay. Then only synthetic fiber swab with plastic shaft. And it should be placed the swab immediately into BTM, that is 2 to 3 ml of BTM. Okay. The chest X-ray has also major role in the diagnosis of COVID-19. In this chest X-ray, we can find consolidation, then reticular interstitial thickening, then ground glass opacities. And chest X-ray has little diagnostic values. Then CT scan. CT scan is not routinely advised, and it should be avoided in children also, because it is a high risk of exposure, radiation exposure, and in later stage it may have cancer. Okay, in CT scan you can find bilateral ground glass opacities. Bilateral ground glass opacities. Here you can find this is bilateral ground glass opacities, GGO. Okay. In next, you can also find crazy paving. Crazy paving are the thickened intralobular and intralobular lines in combination with a ground glass pattern. Okay. Without any repeat testing, means if antigen test is positive, then there is no need of doing RT-PCR. Then next, no retesting is recommended prior to discharge from a COVID-19 facility after clinical recovery, including for transfer from a COVID area or facility to non-COVID area or facility. Means there is no need to repeat a test before to discharge of a patient. Then, if symptoms develop following a negative rapid antigen test, a repeat rapid antigen test or RT-PCR should be done. Okay. Then HRCT should be avoided as much as possible, as the risk of cancer increases in later life due to exposure. As we know, in this war-like situation with overloaded work and stress, being a nurse means to hold all your own tears and start drawing smiles on people's face. Thank you all of you.
Thank you. Geetanjali Behra, ma'am. Ma'am, please start your session.
Good morning, everybody. Myself Geeta Behra, Principal IC, College of Nursing, IMSA. I am here to discuss about active management of COVID-19 positive cases. Second wave of COVID-19, again we are having one invisible world. There is rapid transmission of children and young who are affected. No specific treatment. Vaccination of all type different. Management is challenging. Now we will discuss the type of COVID-19 cases. There are 4 types of cases, that is mild, moderate, severe, and critical. Mild cases are treated or COVID care center. Moderate cases are admitted to dedicated COVID center. Critical cases are admitted into dedicated COVID hospital, where the critical Clinical assessment of the patient. What is clinical assessment? Clinical assessment is an evaluation of a patient's physical condition and prognosis, which is based on information gathered from physical and laboratory examination. After the clinical assessment of the patient, we can differentiate the case as mild, moderate, severe, and critical. In mild cases, the symptoms are fever, cough, malaise, rhinorrhea, mixed running nose, sore throat, and no shortness of breath. These patients are required only home isolation and care. In moderate cases, symptoms are shortness of breath, high-grade fever that is more than 103 degree Fahrenheit, pneumonia and chest X-ray, respiratory rate more than 24 per minute, oxygen saturation level is 90 to less than 93%. These patients are required hospitalization. In severe cases, respiratory rate is more than 30 per minute, breathlessness and oxygen saturation level is less than 90%. In critical cases, all symptoms of severe cases plus hypotension or worsening mental status or multi-organ dysfunction syndrome. These patients are required ICU facilities. Then we will discuss about management of adult COVID-19 patients. According to their severity, we will manage the case. Mild diseases. How we will manage the mild diseases? In mild cases, the mild cases should advise for most dose and mild dose. In most dose, they should maintain physical distancing. That means at least 6 feet distance between two people. Indoor mask use. They should use masks in home and they should maintain strict hand hygiene. Symptomatic management includes hydration, antipyretic for fevers, antitussive for cough, and multivitamins. Stay in contact with treating physician, monitor temperature and oxygen saturation, and they should seek immediate medical attention if they will develop difficulty in breathing, high-grade fever, or severe cough lasting for more than 5 days. A low threshold to be kept for those with any of the high-risk features such as hypertension, diabetes, and age more than 60. For mild dose, there are certain therapies based on low certainty of evidence. Tablet ivermectin. The dose is 200 microgram per kg once a day for 3 days. Avoid pregnant and lactating. Or tablet hydroxychloroquine. The dose is 400 microgram BD for 1 day, followed by 400 microgram OD for 4 days, unless contraindicated. Inhalational budesonide or metered-dose inhaler, dry powder inhaler at a dose of 800 microgram BD for 5 days to be given if symptoms, fever and or cough are persistent beyond 5 days of disease. In moderate diseases, the cases are admitted in ward. They require oxygen supply. As a nursing officer, you have to maintain the target SpO2 level that is 92 to 96%. In COPD cases, that is 80 to 92%. Preferred devices for oxygenation is non-rebreathing face masks. Our clinic encourage all patients requiring supplemental oxygen therapy. Anti-inflammatory or immunomodulatory therapy. Injection methyl prednisolone 0.5 to 1 mg per kg in 2 divided doses or an equivalent dose of dexamethasone, usually for a duration of 5 to 10 days. Patient may be initiated or switched to oral route with stable and recovery. Anticoagulation. Conventional dose prophylactic, unfractionated heparin or low molecular weight heparin, weight-based example, enoxaparin there should be no contraindication or high risk of death. There are certain monitoring, in clinical monitoring, work of breathing, hemodynamic instability, change in oxygen requirement, serial chest X-ray, high resolution of computed tomography of the chest to be done only if there is question. Lab monitoring of C-reactive protein and D-dimer, that is 48 to 72 hourly, complete blood count, kidney function test, liver function test, 24 to 48 hourly. And interleukin 6 level to be done if deteriorating. After clinical improvement, discharge of the patient advanced as per the discharge criteria. In severe diseases, the patient should be admitted in ICU and they should require respiratory support. As a nursing officer, she or he should give respiratory support by the use of non-invasive ventilation, by helmet or face mask, or by the use of high-flow nasal cannula. Intubation should be prioritized in patients with high work of breathing. Use conventional ARDS net protocol for ventilatory management. Anti-inflammatory or immunomodulatory therapy. Injection methyl prednisolone, that is 1 to 2 mg per kg IV in 2 divided doses. Anticoagulation, weight-based intermediate dose prophylactic, unvaccinated heparin or low molecular weight heparin, that is 0.5 mg per kg for dose subcutaneous bleeding. There should be no contraindication or high risk of bleeding. Supporting measures, maintain euvolemia. Euvolemia means presence of the proper amount of blood in the septic shock, manage as per existing protocol and a local antidiagram. Monitoring serial chest X-ray, graphing of the chest to be done only if there is question. Lab monitoring such as C-reactive protein and D-dimer 24 to 48 hourly, complete blood count, kidney function test, liver function test, interleukin 6 to be done if deteriorating. After clinical improvement, discharge as per refined discharge criteria. Then indications. Some drugs that can be used in specific circumstances. Remdesivir may be considered only in patients with moderate to severe disease, no renal or hepatic dysfunction, who are within 10 days of symptoms. Dose is 200 microgram IV on day 1, followed by 100 mg IV OD for next 4 days. Not to be used in patients who are not in oxygen support or in home setting. Tocilizumab may be considered presence of severe disease within 24 to 48 hours of onset of severe disease, raised inflammatory markers, CRP and interleukin 6, not improving despite use of steroids, no active bacteria, fungal or tubercular infection, which 4 to 6 mg per kg in 100 ml NS over 1 hour. Convalescent plasma therapy in early to moderate disease. Convalescent plasma therapy means blood from people who have already recovered from illness to give the other people. Then we will discuss about the nursing management. Nursing management includes assessment, diagnosis, planning and care, intervention and intervention. What is assessment? Assessment is the first step of nursing process. It is a systemic and dynamic way to collect and analyze data about a diagnosis. Diagnosis is the nurse's clinical judgment about the patient's health condition and needs. Then we will discuss about planning and goal. After the nursing diagnosis, she should make a plan and fix a goal to give care to the patient. Intervention. Intervention are the treatment, and actions that are performed to help the patient to reach the goals that are set for them. Then evaluation. Evaluation means outcomes. Whether the expected outcomes are met or not, we should be evaluated. Assessment includes history and physical readiness. In history, the travel history, whether the patient traveled in the last 14 days or contact with the laboratory confirmed case. Physical examination, you have to examine the symptoms of influenza, fever more than body chest condition, GI upset such as nausea, heartburn, anosmia means loss of smell, ageusia means loss of taste. In respiratory and cardiovascular factors, you have to count the respiratory rate and breathing pattern, oxygen saturation level. In cardiovascular system, monitor the heart rate, heart sounds, blood pressure, capillary fill time, and mean arterial pressure. And also assess the anxiety level of the patient and development of acute respiratory distress syndrome. After the assessment of the client, you have to find the problem and needs of the patient. According to the problem and need of the patient, you have to provide care according to their problem. Impaired breathing pattern due to COVID-19 disease. So, for the impaired breathing pattern, you have to assess for sign of difficulty in breathing, provide mode of position, running and breath in all patients requiring supplemental oxygen therapy. After disconnecting the patient from ventilator, administer fluids conservatively to prevent pulmonary edema. Then impaired hemodynamic status. Hemodynamic means hemo means blood, dynamic means movement. The movement of the blood throughout the body. In impaired hemodynamic status, you have to assess fluid balance and skin temperature of the patient, assess tissue perfusion, apply conservative fluid strategy to avoid fluid overload. So you have to give fluid according to the need of the client. It may cause, if you will give extra fluid or a large amount of fluid, it will cause fluid overload or pulmonary edema. Give isotonic crystalloid and avoid hypotonic crystalloid. Isotonic crystalloids are normal saline and rigolactate and avoid hypotonic crystalloid, that is dextrose and normal saline and dextrose. Administer medications which improve noradrenaline and dopamine. In septic shock, in COVID-19 cases, the septic shock is a life-threatening condition. So, as a nursing officer, you have to assess the sign of shock. What are the sign of shock? In sign of shock, the gold and tummy skin, blood pressure become very low, and confusion. These are the signs of shock. Then monitor the patient for hypotension, decrease mean arterial pressure, give 30 ml per kg of isotonic crystalloid in adult infant. body mass index of the patient, monitor the uric and output, monitor blood glucose level, provide nutritious food to the patient, encourage small and frequent meals. If on NG feeding, feed every 2 hours. If on IV fluid, administer fluid strictly as prescribed. As a nursing officer, you have to calculate the body mass index by using formula. Your formula is weight in kg by height in meters square. In anxiety related to disease condition, for the reduction of anxiety, as a nursing officer, you have to provide comfortable environment to the patient, establish rapport with the client, encourage to ventilate his or her feelings, answer the queries of the patient, encourage family interaction through video calling, teach stress reduction and relaxation tips. How to manage the stress? For the stress management, techniques such as deep breathing, meditation, yoga, music, advise the patient and family member to be optimistic. Patient's medication and nutrition should be taken care of. Risk for pressure source. Due to disease conditions, the patient may go for longer and causes pressure source. For the pressure source, assess the pressure points, change the position every 2 hours, provide back care, use appropriate comfort devices, use alpha mattress for comfort, provide high calorie diet, encourage healthy mobilization so that pressure source will be prevented. Then risk for cross infection. As COVID-19 is a contagious disease and it will be transport the infection from one person to another. So as a nursing personnel, you have to aware about cross infection of the disease. So all team members for care and support must turn appropriate PP prior to attending to a patient regardless of urgency of situation. For meticulous hygiene, explain the importance of quarantine, describe how to wash hands, wear masks and disinfect clothes. Discharge of COVID-19 cases. How to discharge the cases from hospital. The patient can be discharged after 10 days of symptoms and no fever for 3 days, no need of testing prior to discharge. The patient will be advised to isolate himself at home, self-monitor for him. Revive discharge policy for COVID-19. Confirm COVID-19 cases. In mild cases, discharge after 10 days of symptoms onset and no fever for 3 days. There is no need for anti-PCR test before discharge. In moderate cases, those cases are fever resolved within 3 days and oxygen saturation maintained without support. These patients will discharge after 10 days of symptoms onset, absence of fever without antibiotic, resolution of breathlessness, and no oxygen requirement. This type of patient should not require anti-PCR test before discharge. In another moderate type of cases, those patients are not resolved the symptoms and demand of oxygen therapy continues. These patients discharge only after resolution of clinical symptoms, ability to maintain oxygen saturation for 3 consecutive days. Those patients also not required as anti-PCR before discharge. In severe double-star cases, discharge only after clinical recovery, patient test negative once by anti-PCR after resolution of symptoms. Then how to manage the dead body? As dead body is contagious, so as a nursing anti-precaution to be followed by healthcare workers while handling dead bodies of COVID-19 cases. Preparing and packing the body in body bag for transport to an autopsy unit, moisture.
Thank you, madam. Thank you for your valuable presentation. Now I'd like to request you to Team Burla, please come for a live session. So we have the questions in the chat box. Request Principal Ma'am and team, please come to the chat box, ma'am. Those who having any doubts regarding the sessions we are covered, please text on the chat box. Our technical team will support you.
Infection prevention control practice and universal precautions should be adopted. Autopsy is to be performed for special reasons. Infection prevention control practice and universal precautions should be adopted. Number of persons during funeral should not exceed more than 20 persons. The funeral, burial, and family members should follow standard precautions. Health education. As a nursing officer, you have to aware the people by giving health education. The health educations are: stay home, expect your medical care. Stay away from others. Use a separate bathroom if you have. Wear a covering over nose and mouth. Wash hands with soap and water at least 20 seconds or with an alcohol-based hand sanitizer. Contains 60% alcohol. Calorie and protein-rich diet with lots of fruits and vegetables should be eaten. Drink immuno-boosting herbal drinks like kadha, turmeric milk, green tea, and herbal tea should be advised. Rehydrate your body by taking 8 to 10 glasses of water, get enough rest and sleep, and be positive. Thank you. A warm greetings to
Thank you, madam. Thank you, madam, for your speech, presentation, and it's a question in the chat box. How do you make an antimicrobial for COVID-19? Kindly, this question is means I don't. We are not getting this question. Antimicrogram. What is antimicrogram? Kindly correct and again write it in the chat box. Over to Narmada madam.
Sir, there is a clarification regarding the question asked by the participant. She's raised that again in chat box. It's anti-biogram.
Okay, we will discuss it in our after end of the session. We have the open discussion. We'll continue in this session. Okay, after this presentation. Okay, ma'am. Over to Narmada, madam.
Good morning, everyone. Myself, Narmada Vista, Tutor College of Nursing, Himsa Burla. Today, I am going to discuss regarding supportive therapy for COVID-19 patients. As hospitals globally experience large influxes of patients with COVID-19 wave 2, a leading cause of morbidity and mortality, so treating the many manifestations and complications requires clinical expertise across the healthcare professional spectrum. Therefore, interprofessional and multidisciplinary collaboration should form the cornerstone of every hospital's COVID-19 management approach. To date, supportive measures have been the mainstay of treatment. What do the term supportive treatment or supportive therapy mean? Supportive treatment refers to what we can do to relieve the symptoms of COVID-19 wave 2 by using some strategies. For example, by closely monitoring patients, we are helping them to breathe easily or comfortably, treating their coughs, and also providing psychological and social support to them and their relatives. Providing these supportive measures through a multidisciplinary approach can optimize patient outcomes during this pandemic situation. Some supportive therapies are listed. First, strategy 1, multidisciplinary meetings. Strategy 2, yearly and frequent ground positioning. Strategy 3, avoid hypoxia. Strategy 4, yearly mobilization and rehabilitation. Strategy 5, evidence-based approach. Strategy 6, psychological support. Strategy 7, social support. Strategy 8, palliative care triaging. Strategy 9, communication. Strategy 10, anxiety and distress among healthcare providers. Let me explain one by one. Strategy 1, multidisciplinary meeting. Daily multidisciplinary team meetings should take place to discuss patient needs, problems, and also formulate comprehensive management plans accordingly. Our multidisciplinary team consists of pulmonologist, infectious disease specialist, internist, rheumatologist, intensivist, nephrologist, and hematologist, as well as nursing supervisor, infection control nurses, case managers, respiratory technicians, physiotherapists, and clinical pharmacologists. Involving physiotherapists and case managers yearly helps patients with who may need rehabilitation services upon recovery. These hurdles provides opportunity for early identification and prevention for high-risk patients by collaborating between the primary team and the critical care team members. Strategy 2, prompt positioning for self-care. Early and frequent prompt positioning should be encouraged for all hospitalized COVID-19 patients with dyspnea, hypoxia, or who require supplemental oxygen support. Recent literature suggests that its use may decrease the need for intubation in patients on high-flow nasal cannula or non-invasive ventilation. True prodding is the process of turning a patient with precise, safe motion from their back onto their abdomen so the individual is lying face down. Prodding is a medically accepted position to improve breathing comfort and oxygenation. It is extremely beneficial in COVID-19 patients with compromised breathing comfort, especially during home isolation. The importance of prone positioning. First, the prone positioning improves ventilation, keeps open the collapsed alveolar units, and it makes the breathing easy. Proning is required only when the patient feels difficulty in breathing and the oxygen saturation decreases below 94. Regular monitoring of oxygen saturation along with other signs like body temperature, blood pressure and blood sugar is important during home isolation. Missing out on hypoxia may lead to worsening of complications. Timely proning and maintaining good ventilation will save many lives in this pandemic situation. During proning positioning, the position of pillow, one pillow should be placed below the neck, one or two pillows should be placed below the chest through upper thigh, and two pillows should be placed below the shins. For self-proning, you will need 4 to 5 pillows. Regular alternations in lying position should be there. Best is to not spend more than 30 minutes in each position of proning position. The positioning for self-proning, time duration, first cycle 30 minutes to 2 hours. The patient should have the position by lying fully prone and the bed should be flat. Next second cycle 30 minutes to 2 hours, lying on right side, bed flat. Then third cycle 30 minutes to 2 hours, the patient should sitting up, adjust head of the bed 30 to 60 degrees. In the fourth cycle 30 minutes to 2 hours, the patient should lie on left side and the bed should be flat. And the fifth or last cycle, the 30 minutes to 2 hours, the patient should maintain the position as the position 1, that is lying fully prone and bed should be flat. Then there are some cautions to be followed when you are adopting the prone positioning. Avoid proning for an hour after meals. Maintain proning for only as much time as early tolerable. One may prone for up to 16 hours a day in multiple cycles, or the patient has felt comfortable. Pillows may be adjusted slightly to alter pressure areas and for comfort. Keep a track of any pressure source or injuries, especially around the bony prominences. Some conditions like pregnancy, deep vein thrombosis, major cardiac conditions, unstable spine, tumor or pelvic fracture, the proning position should be avoided. In emergency condition, non-self-pronatic patient should follow 5-step method to place a patient in the prone position using a regular bed, flat seat and family members. First step, using a flat seat, pull the patient to one side of the bed. In the second step, place the flat seat around the arm that will pull through the side you are turning towards. In the third stage, a second flat seat is placed on the bed and tucked under the patient. This seat will pull through as you are turning the patient. Using the seat, turn the patient over and position the patient prone. The arm and seat will pull across the bed, and in the fifth step, pull and center the patient. Insert the seat that was used to place the patient in the supine position, and then after that, strengthen lines and tubes. Then, strategy 3, avoid hypoxia. As all of we know, oxygen is the key drug in the management of COVID-19 patients who very frequently develops poor saturation of oxygen, resulting in organ damage. So regularly monitor oxygen saturation and target SpO2 should be in the range of 92 to 96%. But in the case of chronic obstructive pulmonary disease, it should be ranged from 80 to 92%. Encourage proning position to avoid hypoxia, and it decreases the demand of supplemental oxygen therapy, which can be used in acute shortage situation of oxygen. Regularly monitor oxygen saturation to identify present in the COVID patient. Strategy 4, early mobilization and rehabilitation. To minimize disability and optimize chances of returning patients to their pre-morbid level of function, our physicians and nursing personnel should encourage early mobilization of the COVID-19 patient. They also work closely with occupational therapists and physical therapists to implement early rehabilitation programs for COVID-19 recovered patients. Strategy 5, evidence-based approach. When faced with many critically ill patients and a highly contagious novel pathogen, many physicians have prescribed treatments as off-label or compassionate treatment. Yet effective treatments can only be identified through large randomized controlled trials. Our hospital is currently involved in several clinical trials of potential COVID-19 treatment, including hemoperfusion and convalescent plasma therapy, and also use of other immunomodulating therapies such as steroids. Nursing personnel must be used evidence-based approach in their clinical practice to render quality care to the patient. COVID-19 has challenged us, especially when it comes to evidence-based nursing, which is not only focused on provision of the best possible care to the patient, but also it protects ourselves from the hidden virus. Strategy 6, psychological support. This pandemic situation can develop varying degree of stress and worsening the pre-existing mental condition of the patient and their family members. It could be due to social isolation, ICU admission, or fear of illness or fear of death. So it can be provided by 3 ways: assessment, analyze, act. In the assessment step, the nursing personnel should do rapid assessment to identify psychological symptoms of patient and their relatives like depression, anxiety, stress. Then after that, you should analyze the level of psychological conditions in a contextual manner. And lastly, after analyze the level of psychological condition, that is act. You should reassure the patient and their relatives and counsel them to adopt positive coping mechanisms to manage their stress. Strategy 7, social support. The social suffering coded into disease stigmatization, social isolation, being barred from the community due to illness and negative perception of the illness. It can be mitigated by taking steps to meet the basic needs like food, shelter, and clothing, and also further steps like community education about the illness and fear of illness and stigma, and creating a voluntary social support group involving the community leaders for social support. Palliative strategy 8, palliative care tracing. That is, palliative care regards dying as a normal process and never intends to postpone death. Palliative care tracing in a humanitarian crisis like COVID-19 situation is classified into 4 categories, and this is adopted from the WHO guideline. First category, color code is red, immediate. That means survival possible with immediate treatment. Emergency palliative care should be integrated with life-sustaining treatment as much as possible. Second, expectant, color code blue, survival not possible given the care that is available. Palliative care is required. That delay, the color code is yellow, not in immediate danger of death, but patient requires immediate treatment soon. Palliative care and symptom relief may be nevertheless be needed immediately. Minimal, that is color code green, will need medical care at some point in the future or acute post-illness. Palliative care may be required for relief of symptoms. Strategy 9, communication. Nursing personnel should communicate updated information regarding the ongoing treatment of patient to their relative and patients also. After consulting with the treating consultant, it prepares the patient and their relatives mentally to accept any mishaps in the future, and also it helps to reduce anxiety level among them. If the communication is not possible by face-to-face due to infection control protocols, then it can be happened by virtual mode like telephony. So there are some tips that should be followed during communication. That means which type of statement we can use and which type of statements we should avoid during communication. The first statement, there is nothing more we can do for the patient. This type of statement should be avoided during communication. In place of that statement, you can betterly use, we will do everything possible to take care of the patient. Next, you must be very strong and brave now. This statement should be avoided, and in place of that statement, you can betterly use, we understand that it is an emotional and it is okay to feel scared and anxious. Next statement, don't worry, patient will die peacefully with these drugs. No, you cannot use this type of statement. Instead of this statement, you can use, you will do the best. We will do the best we can to see that the patient does not suffer and made comfortable. Then next statement, you cannot be with your patient. It can be dangerous for you. This type of statement should be avoided. And instead of this statement, you can betterly use, I am sorry that you can't have your loved one around you. We are doing everything possible to protect you while we are caring for your loved one. Strategy 10, anxiety and distress among healthcare providers. It is the healthcare providers caring for COVID-19 patients suffers from anxiety and depression due to the risk to their own life, burnout situation, and compassion fatigue. So after all, it provides an opportunity for all healthcare providers, especially the nursing personnel, to improve their professional knowledge and different skills in clinical practice. It also provides a good opportunity for the nursing professional to serve their nation and serve through the people. So don't be panicked, have patience and follow proper guidelines when dealing with the COVID-19 positive cases. The authorities should ensure all facilities and precautions to their staff. The healthcare providers should maintain hydration, which enhances mental and physical well-being of the patient and also the nursing personnel. Different relaxation techniques should be adopted by the nursing personnel or healthcare providers to adapt to cope up with this pandemic situation in a better way, and it will help to reduce the health personnel's anxiety level and to have a better life. Okay, thank you very much. Thank you very much. Thank you, COVID warriors.
Thank you, madam. Thank you for your presentation. Participants, those who have any question or related to any questions to this topic, kindly text in the chat box, and we will discuss in the open discussion. And for next, I request Miss Renuka Das, madam, Vice Principal, College of Nursing, to present her topic. Over to you, ma'am.
welcome to my slide. Good morning to all and welcome to my slide. I, Shruti Rangadass, Vice Principal IC, College of Nursing, Vinsapura. Nowadays, COVID-19 have taken a considerable place of problems which is worldwide problems. Therefore, as a health personnel, nursing officer, all should remember it and accordingly provide the care of COVID patients. Today, our discussion is how to take care and prevent the complications of COVID-19 patients. SARS-CoV-2 is a novel virus and it has perturbed the medical science and has become a puzzle in terms of mutation, rapid spread, clinical spectrum, and wide-ranging complications. In India, second wave of COVID-19 has created one-like situation. Again, though 15% require hospitalization, long-term complications bring about human suffering, sickness, and affect quality of life of the people. In this context, management of complication assumes significance and role and responsibility of nurses or nursing officers in providing care which is very challenging to them. Here you see there is a COVID-19 patient in OPD hospital, which patient is in ICU unit. The COVID-19 complications. Those are invasive mechanical ventilation, ventilator-associated pneumonia, venous thromboembolizing, catheter-related bloodstream infection, pressure, stress, ulcers, and gastrointestinal bleeding. ICU-related weakness. Then, invasive mechanical ventilation. We will discuss one by one. Daily assessment of readiness. Then, to breathe spontaneously, it is the involvement of an instrument. By mechanical ventilation, we should know that it is the involvement of an instrument inside the trachea through the mouth, such as endotracheal tube, or the skin, such as a tracheostomy tube. So, the patient is kept through mechanical ventilation by insertion of ventilator tubes or circuit. Then try your level best for daily assessment. Daily assessment for breath spontaneously in mechanical ventilation, intact respiratory muscle, bronchus expansion, and chest wall, and during the air expiration. The diaphragm may actually contract during expiration. Then it is assessed by the doctors as well as the nursing officers. Then, if the patient's condition improves, the tube is extubated or removed. Then observe for pneumothorax. The pneumothorax is vary from mild to life-threatening, like shortness of breath, chest pain, which is very sharp chest pain, no discoloration of skin, lips, tachycardia, tachypnea. It is called also collapsed lung. As a nursing officer, you have the most responsibilities to assess it and inform the doctor immediately, and accordingly you care the patient. Then minimize continuous or intermittent sedation. How will you minimize? By the advice of doctors. Then, according to assessment of doctors, the sedation is reduced if the respiration improves and the patient starts for a spontaneous breathing. Then allow patient for different method of communication. There are different methods of communications, you know. Allow patient for different method of communications like verbal. If the patient is good condition and can also answer your questions. You ask something, then answer will be come from patient side. Then non-verbal, which is more than the words. Example, nodding the head, yes or no, wrinkling of the face, etc., which you can imagine that the patients still have pain if the patient's facial appearance changes. Then written communication. If the person is literate, then try your level best to give the paper and pen to communicate by writing. Then visual communication. By visual you can show the tablets or medicines, etc. These are the different methods of communications. Then come to ventilator-associated pneumonia. It develops due to patient's condition through which the patient remains on the bed maximum time. So, oral intubation is preferable to nasal intubation in adolescents and adults. It is easier. Oral intubation is easier to perform faster and less than nasal intubation. Under direct laryngoscopy to look for larynx and the tube go into the trachea to support for breathing. In COVID-19 cases with the complicated cases like pneumonia, emphysema, heart failure, collapsed lung, etc. So, in this case, in second phase, we will see the patient person and keep the patient in semi-recumbent position. You see the figure of the picture, right side of the slide, the head of the bed, elevation 30 degree to 45 degree. So use your closed suctioning system. That means the suction will be performed in between to clean the secretions. Then periodically drain and discard condensate into it. Certain obstruction takes place due to continuous mechanical ventilation. So you clean the tube. New ventilator circuit for each patient. So we change the circuit and take the help of the technician there to discard the previous circuit and change the next another circuit to the another patient. So change circuit if it is solid or damaged but not routinely. If the patient is safe, so you can change the circuit if it is damaged. The next complication is here you see in COVID-19 patient in COVID hospital wings are full in ICU unit. The patient had kept in semi-recumbent position. So it reduces the risk of pneumonia. Then come to next complication, venous thromboembolism. It is the condition the blood clot forms mostly by thrombus or blood clotting. It always affects the deep veins. If the thrombus breaks off, it embolizes and flows towards the lungs due to immobilization and hospitalization of the patient. So accordingly, you use pharmacological prophylaxis, that is heparin 5,000 units subcutaneously BT for adolescents and adult without contraindications. If there is no any contraindications, then the group of medications are the tablet forms: enoxaparin, bemiparin, cetoparin, timidaparin. These type of medications you can give the injectable subcutaneously, and sometimes if the patient's condition is good, orally it can be administered. It cannot bind both antithrombin and thrombin, so the clotting is reduced. Risk for this disease. The mechanical prophylaxis, intermittent pneumatic compression. Then you see the mechanical prophylaxis, intermittent pneumatic compression device. The patient have taken the device and using the device. That it is a technique, a device. You can imagine from this picture that include an air pump and inflatable auxiliary sleeves, gloves, or boots is a system designed to improve venous circulation in the limbs of patients who have risk of DVT or pulmonary embolism. So, if there is available of this device, you also can use there. Then the next complication is catheter-related bloodstream infection. Catheter-related bloodstream infection is another existing problem or complications. It arises from central venous catheters. The incidence may exceed 10% and the mortality of up to 25%, and it increases hospital length of stay. So steroid precautions to be taken during the procedure. So the catheter, when the performing the central venous procedure, the catheter is given through peripheral vein or proximal central vein. Most commonly, it is used in internal jugular, subclavian, or femoral veins. Catheter-related bloodstream infection is defined as the presence of bacteria originating from an IV catheter. It is one of the most frequent complications of central venous catheterization. It is most common cause of nosocomial bacteria also. So, ଆପଣମାନେ ସମସ୍ତେ ଯେତେବେଳେ ପ୍ରୋସିଡ୍ୟୁରଟି ହେଉଛି ସେତେବେଳେ ସବୁ କ୍ଲିନ୍ ପରିବେଶରେ ଷ୍ଟେରିଲାଇଜ୍ ମେଥଡରେ ଏଇ କ୍ୟାଥେଟର ଦ୍ୱାରା ଡକ୍ଟରଙ୍କୁ ସାହାଯ୍ୟ କରନ୍ତୁ। Then we will discuss now pressure sore. Pressure sore also is very common, very worrisome complication of the patient who is completely bedridden patient. So turn the patient every 2 hours. So side change to be performed by the nurse officers by the help of 4 grade staffs there. Frequent repositioning, the position to be changed frequently. In between, a pillow under the tailbone, shoulders, heels, and elbow to be provided to reduce the risk of pressure sores. If it is needed, apply moisturizers. Then, manage incontinence, keeping the area clean and dry. এই সব পেশেন্ট মানଙ୍କର catheter दियाउथो indwelling catheter और Colles catheter अपन माने दउथवे भी हेल्प भी करूथवे तेणुकरी से समय क्लीन मैनेजमेंट करतो आ स्टेरॉइड मैनेजमेंट करतो आउ से अंकर पेशेंट रो स्किन जल्दी क्लीन थिबो आ ड्राई थिबो then use special pressure relieving mattress and cushions example air mattress and water mattress आपण माने देखिछंती सब आईसीयू डिपार्टमेंट रे ए सब मैट्रेस अवेलेबल होची पेशेंट जोथरे की आराम रे कंफर्टेबली सेटा रेस्ट ले परिबे एवं ए सब रिस्क जो प्रेशर सोर रिस्क टिके कम थाके then come to stress ulcers and gastrointestinal bleeding. Give early enteral nutrition within 24 to 48 hours of admission. It is the enteral feeding, the preparation of the solid liquid food that contains nutrition like protein, carbohydrates, lipids, vitamins, and minerals in which is given to the stomach through tube feeding. Then administered histamine to receptor blocker or proton pump inhibitors in patients with risk factors for GI bleeding. Histamine to receptor or H2 blockers. These are the medications which neutralize the hydrochloric acid of the stomach. For example, famotidine, ranitidine, pantoprazole, ramiprozole, etc. It reduces the over-secretion of hydrochloric acid in stomach and reduce the risk of GI bleeding. The last part is ICU related weakness. It is clinically detected in ICU units where the patient having weakness, which is common in ICU and critically ill patients, such as acute illness like COVID-19 or other cases. It creates novel form of weakness. Therefore, when the patient conditions become stable, no need for mechanical ventilation. As far as possible, shift the patient to general COVID unit. Therefore, early mobilization is better. ଯେତେ ଶୀଘ୍ର ପାରୁଛନ୍ତି ପେସେଣ୍ଟର କଣ୍ଡିସନ ଭଲ ହେବ ବୋଲେ ତାକୁ ଆଇସିୟୁ ରେ ନ ରଖିକି ଶିଫ୍ଟ କରିବା ଉଚିତ. Step 1, set of equipments like chair, trolley, bed, transfer belt, mobility aids, etc. The patient is going, you see from the picture, the patient is going from COVID ICU to general ICU unit. In step 2, calm and quiet environment. When you are shifting the patient, calm and quiet environment to be provided. In step 3, crash trolley. If there is no provision of trolley with the bed, and take crash trolley with the patient, which contains emergency medicines or injections. Step 4, monitor the progress of the patient closely. In between, you closely monitor the condition of the patient because patient is going or moving to the general unit of the COVID. You see, this patient from COVID hospital ICU unit, that is Grimsarpurla, is preparing to shift general unit. So, आपण माने सबको कोविड हॉस्पिटल ले ड्यूटी करछथि आपनकर रेस्पोंसिबिलिटी आपनकर साहाय्यर हात पेशेंट मान को बढाइले पेशेंट मान के अति खुशी रे ओ जल्दी आरोग्य होई जनरल वार्ड को जिले आ आपण माने जेतरे जनरल वार्ड पुनी भलो होई निज घर को कहिबे समस्त कर आपन मानकर भी बहुत आपन crucial work. So I am thanking you and for your dedication work. Thank you again, nursing officers, for your dedicated service.
Thank you, madam. Next, I request Ms. Nirupama Mishra, tutor, College of Nursing, Vimsar Bulla, to present her topic. Over to you, madam.
Thank you.
Good afternoon to all of you. Myself, Nirupama Mishra, tutor, College of Nursing, Vimsar Bulla. Good afternoon to all of you. Myself, Nirupama Mishra, tutor, College of Nursing, Vimsar Bulla. I would like to teach you a topic from COVID-19. See the image and guess something. What may be the topic? It's okay. The topic name is immediate implementation of infection prevention control measures. Introduction of IPC measures. According to Henry de Brogden, an ounce of prevention is worth a pound of cure. It means if we put a little effort to prevent a problem, then we have not to put a lot of effort to solve the problem. Nowadays, COVID-19 is a highly infectious or contagious disease that spread from person to person, and footfall or admission rate in the hospital is increasing day to day. While rendering services, there is chance of hospital-associated infection. It is certainly called as HAI. In this context, aim of healthcare delivery system is to do no harm to anyone, and it can be possible only by immediate and strict implementation of infection prevention control methods. It is a scientific approach and practical solution designed to prevent harm caused by infection from microorganisms to patients and healthcare workers. In healthcare facility, transmission of infection from patient to patient, patient to healthcare personnel to patient, and healthcare personnel to healthcare personnel. Prevention and precaution are like the two sides of a coin. They are interrelated with each other. Now, we will discuss regarding the types of precaution. It is mainly divided into two types. One is standard precaution and another one is transmission-based precaution. First one is the standard precaution. What is standard precaution? It is the precaution that applies to the care of all patients in all healthcare settings, irrespective of their disease state. It means whatever may be the disease and wherever may be the healthcare setting, the patient is staying. Application of standard precaution is same for all, for everyone. The precaution may apply when there is a risk of potential exposure to what? Blood, body fluid, mucous membrane, and non-intact skin. Measures of standard precaution. There are mainly 8 measures of standard precaution. Number 1 is the proper hand hygiene. Number 2, use of PPE. Number 3, respiratory hygiene and cough etiquette. Number 4, prevention of needle stick or sharp injury or safe injection practices. Number 5 is the cleaning and disinfection of devices and environmental surfaces. Number 6 is the spill management. Number 7 is the workplace management. And number 8 is the safe biomedical waste management. We will discuss it later, one by one. First and foremost, standard precaution is performing hand hygiene. Hands are the main pathway of transmission of germs. So, maintaining hand hygiene is very important to prevent infection. Hand hygiene is also called as hand washing. It is the act of cleaning hands with soap, hand washing solution, or alcohol-based solution to remove virus, bacteria, microorganisms, dirty substances, and other harmful substances. See the poster of hand hygiene of health and family welfare government of Odisha.
before and after touching a patient. रोगी को छुईबा पूर्व Second is the before clean or aseptic procedure, that is the संक्रमण मुक्त पद्धति पूर्व. And third one is the after touching patient surrounding. रोगी रो चारिपाखरे थिबा पदार्थ छुईबा पूर्व. And fourth one is the after body fluid exposure, that is शरीर रो निर्गत तरल पदार्थ छुईबा पूर्व. There are mainly 7 steps of hand washing. Number 1 is the rub palms together, rub the back of both hands, then interlace fingers and rub the hands together, then interlock fingers and rub the back of fingers of both hands, then rub thumb in a rotating and downward manner, followed by the area between index finger and thumb. After that, rub fingertips on palm for both hands. And the final step is rub both wrists in a rotating manner, rinse and dry thoroughly. According to WHO, 5 golden rules for hand hygiene. Number 1 is the hand hygiene must be performed at the point of care. It means when you provide the care, then you must wash your hand properly. Then number 2 point, the during care delivery, there are 5 moments. It is essential to perform hand hygiene. The 5 moments are: first one, the before touching a patient; second, before clean or aseptic procedure; third, after body fluid exposure risks; fourth, after touching a patient; 5, after touching patient surroundings. These 5 steps, which also called as my 5 moments of hand hygiene. Third golden rule is hand rubbing with an alcohol-based formulation. If available, makes hand hygiene possible at the point of care. It's faster, more effective, and to be better tolerated. And number 4 golden rule is hand washing with soap and water. It's necessary when hands are visibly soiled or dirty. And number 5 golden rule is the appropriate technique and time taken to clean hand is also very important. Follow these 5 steps every time. Wet hands, apply soap. Leather hands or bubbling the hands. Scrub at least 20 seconds. Rinse hands, dry hands. Drying of the washing hand is part of the process, as wet and washed hands are more easily decontaminated. So always dry your hand before putting gloves or before doing any work. Use hand sanitizer if washing is not an option. Must be at least 60% alcohol based. After washing hands, wearing of gloves is very necessary to prevent infection. So every nursing personnel should know the gloving technique properly. Gloving technique is mainly 2 types: open gloving technique and closed gloving technique. In open gloving technique, for sterile tasks performed by non-sterile team members. And in closed gloving technique, for applying sterile surgical gloves after the sterile gown has been donned or put on. Both open gloving technique and closed gloving technique steps are same. But in closed gloving technique, the top of the gloves is put above the wrist of PPE kit or above the wrist of any sterile gown. The steps of gloving techniques are: number 1, pick up one glove with thumb and forefinger or index finger, it's like the picture. Pull glove on hand. Number 3rd step is slip partially gloved hand under cup of second hand. And number 4, pull second gloves over other hand and pull glove up or down wrist. Number 5 is the slip fingers up completely gloved hand under cup of first hand, pull glove is down wrist. And number 6, this is the final gloved procedures completed. After performing any procedure, gloves should be removed in a proper way. During removal of gloves, contamination rate is very high. So use proper technique while remove the gloves. It is also called as big method. Big means what? The hard pointed part of a bird's mouth. This gloves removal technique has 6 steps. Number 1, using one gloved hand, pinch and pull the base of other gloved hand, like the picture. Number 2, use the middle finger to scoop the top of the gloves fingers and thumb to form a beak. It's like the hard-pointed part of a bird's mouth, that is the phantom, like phantom. And number 4, with the picked hand, pinch the opposite globes at the base and pull the globe. Number 5, roll the globe inside out and up the hand. And number 6, with the ungloved hand, use the index finger to pull the picked globes off at the base of the beak and dispose into appropriate waste container. It's like the picture. Always wash your hands after globe removal. What to standard precaution is use of PPE. What is PPE? PPE is the personal protective equipment. It protects ourselves from different infections. It contains disposable wound, disposable non-amino gown, 3-ply mouth mask, that is the triple layer surgical mask, surgical gloves, disposable eye care or goggles, and disposable shoe cover. See, one COVID warrior is wearing a full set of PPE kit. As an nursing personnel, you have to know how to wear the PPE kit and how to remove the PPE kit. There are several steps how to wear the PPE kit and how to remove the PPE kit. First is the donning method. Before wearing the PPE kit, first wash your hand thoroughly by the 7 steps. Then wear PPE kit, then wear masks, then wear goggles, then wear gloves. And in the doffing method, first remove your gloves in the red bucket. Then remove your PPE kit. Then remove your goggles. Then remove your triple layer surgical mask. Then wash your hand thoroughly. You should remember, risk of self-contamination is very high when removing PPE. Third standard precaution is respiratory hygiene and cough etiquette. To maintain respiratory hygiene is very important to prevent or to avoid COVID-19. Wear your mask properly. It comes all the way up, close to the bridge of your nose, and all the way down under your chin. Keep it snug to your face. Means your mask should be fitted properly, that not loose and that not tight. Cover your mouth and nose with a tissue to cough and sneeze, then clean your hands thoroughly. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow. It's like a picture. Third, standard precaution is prevention of needle stick or sharp injury or safe injection practice. What is needle stick injury? Needle stick injury is the accidental skin penetrating wound caused by needle, scalpel, glass, blade, etc. Nurses' role to reduce the risk of sharp injury are what you do and what you don't do. What you do? Use needle cutter or destroyer. Then separate sharps from other waste. Don't mix with other bin. Use rigid puncture-proof disposal bin. Empty sharps container when they are harmful food. When the container is harmful food, then empty the container. Don't wait to completely full. Then what you don't do? Handle, empty or transfer used sharp between containers. Do not recap sharps. Don't recap the sharps before disposal. As a nursing personnel, you have to know the 7 steps of step injection practices. First one is to clean your workplace, then to maintain proper hand hygiene. Third one is the sterile safety engineered syringe. What is the sterile safety engineered syringe? It means always use a new syringe, packed syringe. Then sterile vial of medication and diluent. Use skin disinfection and appropriate collection of sharps. Don't put here and there. The 7 steps of safe injection practice is appropriate waste management. If an SI happens unfortunately, then don't be panicked, be calm and quiet and do action immediately. Wash the hand with soap and water. Don't apply pressure to the infected wound. Allow it to be bleed freely. Then identify the patient involved. from whom you are injected. Then immediately report your injury to your supervisor. Do not wait until the end of your shift or the end of the procedure. Follow the direction for any necessary blood test, vaccination, or medication to prevent infection. Then document the incident in the forms provided by hospital, that is OVR and EPI net form. What is OVR form? OVR is the occurrence variance report form, and EPI is the exposure prevention information network form. The 5 standard basic principle measures is cleaning and disinfection of devices and environmental surfaces. As a nursing personnel, it is important to ensure that cleaning and disinfection procedures are followed consistently and correctly. All surfaces in healthcare facilities should be routinely cleaned and disinfected, especially high-touch surface or wherever visibly soiled or contaminated by body fluid. To clean the surface with water and detergent first, then to apply disinfectant solution, that is sodium hypochlorite 1% or ethanol. And the equipment should be cleaned by ethyl alcohol 70%. If not more required, then don't touch wall, switchboard, etc. If urgent, then touch the wall or switchboard with a tissue paper. If tissue paper is not available, then touch with a plain paper and discard the paper appropriately. If blood and body fluid unfortunately pour down in the floor, then don't be panicked. Cast well PP, then pour down, cover with absorbent or pour fresh 1% sodium hypochlorite. But it's pour down means demarcate the area, then on that pour down substance, put a newspaper or a cotton cloth. Then wait for 20 minutes. After 20 minutes, discard it away. Then wash your hand. Then replace content of spill kits and recordings to prevent infection. Your workplace should be clean, and the workplace management rule is 5S. What is 5S? Sort, set, sign, standardize, and sustain. Sort is the identify and remove unwanted, unused item from the workplace. Remove and identify the unused and unwanted items. Then set in order. Organize everything needed in proper order for each operation, or a place for everything and everything in its place. Then sign. Maintain high standard of cleanliness in your workplace. Clean and inspect through cleaning. Then standardize. Make up the rules, follow and enforce them. Then sustain. Part of daily work, and it's become a habit. It should be a continuous process, not an intermittent process. A real example of before starting the medication and after starting the medication. Number 8, standard basic principle is set biomedical waste management. As a nursing personnel, you have the complete knowledge regarding segregation of hospital waste management. In green bucket, for kitchen waste, paper, tissue, water bottles, can, etc. And in red bucket, put syringe, gloves, plastic waste. And in yellow bucket, put soil, anatomical parts like placenta, chemical liquid, cytotoxic, laboratory waste, expired and discarded medicine. Then in glassware, antibiotic vial, metallic implant, glassware material, except cytotoxic drugs. And in the cherry red color bin, used for needy and what classes. See the real image of our COVID ICU. There is a COVID warrior putting her gloves in the red bucket. The transmission-based precaution. What is transmission-based precaution? It is the set of practices specific for patient with known or suspected infectious agent that requires additional control measure to prevent transmission. Is specific for patient, used in addition to standard precaution. Where PP for contact and droplet precaution is must. Use disposable or dedicated patient care equipment. Dedicated means what? The sharing patient care equipment. If equipment needs to be shared with patient, Clean and disinfect it between use for each patient by using ethyl alcohol 70%. Use adequately ventilated single room, preferably, or a dedicated COVID-19 wards room with dedicated bathroom. What is dedicated COVID-19 ward? That is the general ward. COVID-19 general ward with dedicated bathroom is the sharing bathroom. In that case, the bathroom should be cleaned at least twice daily. Or if possible, after every use, please disinfect the bathroom. Then avoid transporting COVID-19 patient out of home unless until medically necessary. Place a mask on COVID-19 suspected and confirmed positive cases if transport out of room is medically necessary. Healthcare workers should wear appropriate PPE during transport to prevent infection. Then restrict the numbers of visitors allowed because COVID-19 is a contagious disease. So to decrease the spread of transmission, COVID-19 IPC priorities. There are mainly 4 IPC priorities. First one is the rapid identification of suspect cases for family members and relatives. But to identify, screening or trial at initial healthcare facility and rapid implementation of source control. Then limiting entry of healthcare workers or visitors with suspected or confirmed COVID-19 because it is a contagious or infectious disease of transfer from one person to another person. So be cautious. Then second IPC priority is immediate isolation and referral for testing. Group patient with suspected or confirmed COVID-19 take separately. Test all suspected cases for COVID-19. Then third IPC priority is safe clinical management. Immediate identification of inpatient and healthcare worker with suspected COVID-19. Then number 4 IPC priority is adherence to IPC practices means use PPE appropriately. Implementation of IPC and trials. Provide triple layer surgical masks to the suspected patient and provide an isolated room to a direct patient that is confirmed COVID-19, confirmed positive COVID-19. Maintain at least 1 meter distance. Instruct all patients to cover nose and mouth during coughing or sneezing with tissue or textile for others. Perform hand hygiene after contact with respiratory sickness like coughing, sneezing, etc. Apply droplet precaution. Use a triple layer surgical mask with properly fitted. As on earlier picture, when providing care in close contact with a patient with respiratory symptoms, coughing or sneezing, use eye protection like face masks, goggles, face shield, etc. because spray of secretion may occur. Limit patient movement. What is limit patient movement? Limit the patient movement within the health center or within the ward to reduce potential infection throughout the healthcare facility. Apply contact precaution. What is contact precaution? Contact precaution is a measure used for disease caused by microorganisms that may be transmitted easily by contact with the patient intact skin or with contaminated environmental surfaces. The contact precaution measures are performing hand hygiene to prevent cross infection, using PPE kit while entering ward or room, removing PPE kit while leaving the room or ward, then disinfecting equipment while sharing with ethyl alcohol 70%. Refraining touching body parts unnecessarily to prevent infection that may be gloved or that may not be gloved. Avoiding contaminating environmental surfaces, ensuring adequate ventilation in a room or to prevent infection. Apply airborne precaution when performing aerosol generating procedure. What is aerosol? An aerosol is a suspension of fine solid particular liquid droplet in the air that comes from mouth and nose. During some procedures, the aerosol generating procedures are endotracheal intubation, bronchoscopy, cardiopulmonary resuscitation, tracheostomy, and autopsy procedures, etc. For performing aerosol generating procedure, don't forget to wear PPE kit with N95 respirator. The scheduled field test should not be confused with user seal check before its use. Before use PPE kit, must check the seal. It's sealed or not. Then whenever possible, use adequately material at single room when performing aerosol generating procedure. Avoid the presence of unnecessary individual in the room because to prevent infection. Then care for the patient in the same type of room after mechanical ventilation commences. Thank you a lot to listening my teaching patiently. Thank you.
Good morning, everyone. Myself, Narmada Mishra, Tutor, College of Nursing, himself.
Thank you, madam. Thank you for your presentation. Next, I request Mrs. Sanjukta Sahu, madam, Director of Nursing Odisha, to continue the session.
Good afternoon, everyone. We are joining again. We have with us our chief patron, I should say, our previous secretary, ma'am, ma'am Anu Garg, ma'am, who is the principal secretary now in Water Resources. For the last more than 1 year, she has been heading the capacity building team for COVID-19 training throughout the state of Odisha. Under her guidance, we have conducted and still continuing to conduct all these trainings for COVID-19 for medical officers as well as staff nurses, paramedicals, in up to the ASA level. That's really, these trainings have been conducted, and we are very fortunate that she has given her consent to join with us today. I'll request ma'am to speak a few words to motivate our teachers who have painstakingly prepared for this training, as well as the trainees who have joined with us. Ma'am, please take over and say a few words.
Thank you. Thank you. So, friends, I am very happy to be here with you. आउ मु बस एटा कहबा को चाहूची जे आमे समस्ते जानिछु these are difficult times, विचित्र बिल्कुल जो जिनसा आमे जम्मा जानी नथिलु सेटा हेछि, किंतु आपण माने जो रोल प्ले करूछंती ता पई आपण मानंकु आमे समस्ते ऑफिसर हिसाब रे मु कहूची, तापरे आमर समस्तंकर भाई भौणी बंधु बांधव आपण मानंकर जोगु हॉस्पिटल जाई करी बाहरु छंती स्वस्थ हेई करी, सो आपण मानंकु बहुत भलो काम करू छंती एते डिफिकल्ट सर्कमस्टेंसेस रे, फॉर दैट आपण समस्तंकु आमे हार्दिक अभिनंदन जणाउछु. वी आर वेरी वेरी प्राउड ऑफ ऑल ऑफ यू. आपण मानंकु केते ब्लेसिंग्स भी मिलुथिबो जो माने ठीक हेई करी बाहरी जाउ छंती, जो मानंकर आपण सेवा करू छंती, किंतु आजी मु आपण मानंक सांगरे बुझिबा को चाहूची जे जो ट्रेनिंग आमे करूछु वर्तमान सेटा आपनकु केमती लागुची, आपण चाहूछंती कि एटा ही कंटिन्यू हो कि आमे आउ कोन आपनकु सिखै परिबा. जहा मोते लागुची जो बाहरे लोक माने कहउछंती से मानंकु जो 2-3टा जिंस लागुची जे ऑक्सीजन ठीक भाबरे आमे केमती लगाइबा सेटा आपण माने पूरा अभिज्ञता जानिबा हेबा, माने यू विल हैव टू बी अभिज्ञ सो दैट केते लीटर पर मिनिट रे लगाइबा कथा, को टाइप रो लोकंकर रे केते लगाइबा कथा, तापरे जो लोक आसुछंती एटा आमे कंप्लेंट बहुत सुनुछु बाहरे जे जदि तांकु तांकर सपोजिंग डायबिटीज अछि कि तांकु यूरिनरी किछि अछि तो तांकर से सब डिजीज पई जो औषध देबा कथा सेटा मध्य आपण मानंकु आइडिया पूरा रखिबा को पड़िबो. तापरे प्रोनिंग पोजीशन उपरे जेहेतु एबे एते आसुची ताले सेही समय रे आमे प्रोनिंग पोजीशन रे करि परिबा नै सेटा आपनको देखिबा को पड़िबो. तापरे रैशनल यूज ऑफ ऑक्सीजन, जेहेतु ऑक्सीजन रे एबे एते प्रॉब्लम होची सब आड़े, आमे जो ऑक्सीजन यूज करूछु सेटा आमे ठीक भाबरे यूज करूछु कि नै. तापरे पेशेंट्स को हैंडल, यू सी आपण मानंकु I know आपण माने बहुत hard pressed छंती जेहेतु difficult time अच्छी आपण जाई पारु नाहती बहुत जिनस अच्छी किंतु आपण patient र भी मानसिकता टिके बुझंतु जे से भी केते डरी करी अच्छी तापरे तार आमर सबु बेडे अभ्यास जे आम संगरे आमर जने अटेंडेंट सबु बेडे जाइतेला जाऊ आगे किंतु वर्तमान सेटा हेई पारु नहीं तो से निजे किछि जानी पारु नहीं तार डर भी ताकु माडुछि सो एही समय रे टिके आपण माननको आ ह्यूमन मोते लागुछि भी हेबाकू पड़िबो सेटा कष्ट कहीं कि आपण के पाखरे एते काम अछि सेतिरे आपण कोन समस्तन के संगरे गपी परिबे बट आपण जदी तांकु टिके सेही समय रे पेशेंटली बुझेई परिबे जे आपण के एमती आमे करूछु एटा होउची तांकु टिके आमे जदी हैप्पी मूड रे बुझेई करी रखिबा दैट विल बी अ वेरी बिग सर्विस टू देम बिकॉज मोस्टली पेशेंट्स भितरे किछि जानि पारु नाहती जेहेतु तांकर तो अटेंडेंट भी किए नाही का संगरे कथा नहीं बार्ता नहीं तापरे एज मु जो लास्ट आपण का सेशन देखुतिली बहुत भलो सेशन आपण निजर केमिति ध्यान रखिबे सेटा आम पई बहुत इंपोर्टेंट आमे चाहूछु आपण माने समस्त ठीक रहउछंती सो रहंतु सो आपण सेटा देखिबे कोन कोन अछि एंड आमर उद्देश्य आपणक आमर रहिबा कथा जे केमिति आमे डेथ्स अवॉइड करिबा केमिति आमे आमर पेशेंट जे आसुची जो अवस्था रे भी आसुची ताको आमे केमिति ठीक करी करी बाहर करिबा सो आपण माने ऑलरेडी बहुत भलो काम करूछंती किंतु आपण माने टिके हमको आजी 4-5 जण कहंतु जे आउ कोन आपण को दरकार कि आमे हमर ट्रेनिंग रे लगाई परिबा सो बाला would you like to just put 2-5-6 people who can tell us कोन से माने चाहुछंती आ बाकी समस्ते तांकर चैट्स रे छाड़ी देबे थैंक यू
Ma'am, we are connecting, ma'am.
थैंक यू
The feedback has been sent, I think, by Chinmay. Feedback form.
Yes, sir. I have sent the feedback form. In that,
Sir,
sir,
actually, ma'am want to.
No, that is all right.
Yeah,
You
okay.
continue with this.
Sir.
Yes.
मैम नमस्ते मैम एक्चुअली हमको अभी आईसीयू मैनेजमेंट ऊपर जब विशेष किसी जणा पड़ी था तले सेटा टिके और अधिक हेल्पफुल हेतांदा सो दैट हम पेशेंट मन को बेटर केयर दे पड़ी थांतु
I will tell that we are unmuting you. Devjani Naik, can you? Devjani Naik. Hello, participant Devjani Naik. Are you there? Devjani. Hello. Anupama Sahu, are you there? Hello. Anupama, are you there? Anupama, are you there?
Yes, ma'am. Yes, ma'am.
We'll unmute you. Please give your feedback to ma'am. Okay, ma'am. Ask to unmute. Ask all to unmute.
all participants to.
Please continue. Please continue.
You have unmuted the participants. So please give your feedback to ma'am. Hello. We have unmuted all the participants. Please give your feedback. Please come forward and give your feedback. अरे डरुचो कहीं की?
No, it's very good. आपण कहले ICU management उपरे आपण आउ चाहुचंती. We will include that. तापरे आउ anybody has anything to say? बाकी आपण feedback form रे देबे. कि भलो कहले कि कहले नहीं. I am interested in the content. Content रे आपण आउ कोन टाइप रे जिंस चाहुचंती.
This is not convergence. Apart from the CFC, SFC, CSR, and other local funds are converged with this funds of Samagri Shiksha, if any available for MP production.
I'm sorry, I didn't get that. Bala, I didn't get that.
Not clear. Radio was not clear. Repeat करिवे कि भाई? आउ थोड़े कहिवे कि? Hello, audio टिके सुबिला नहीं. आउ.
Somebody, Nirupama Mishra, if you are there, please say something. Unmute yourself. निज phone unmute करी कौन तो? Manjit Naik. I don't know why all these people are not saying. Lakshmi Priya.
It's all right. It's all right. I think then let us close the session because there are some, I think, connection issues. But ए मानम को कहंतु यदि लेखित देबा को चाहुचन.
Yes, ma'am. Manjil Naik here.
Manjil.
Please say something. Was the training to your liking, or anything else you want to know more, so that we can give it to you?
No.
Okay, ma'am. It was a very interesting, elaborative, and knowledgeous. Still, I agree with the person. Means we need some ICU management, and also we need some steps how people will take preventive measures. They are also still the village people, the lay people who don't know anything. Also, we should include something. They will practice their in home, like they don't know how to take the. Now it is told that the steam inhalation is very effective. So in some leaflet or in some anything like that, they should get the knowledge because they are.
Thank you, Manjulata. I take your point. आपण चाहुचंती होम आइसोलेशन रे हमें किछि कहबो. आपण हमर डिपार्टमेंट गोटे होम आइसोलेशन वीडियो तयारी करछि. हमें समस्त संगरे सेटा वेबसाइट रे अछि. हमें आपण संगरे शेयर कर देबो आजि पे. And from next meeting we will try to include it. Home isolation video.
Hello. I think she wants that when they are at the healthcare facility, the nurses, and they are coming in contact with many people, they especially not in ICU, in the ward, that is the moderate cases they are dealing. The attendants and all, I think they want to educate them. Yes, she wants this.
Yes, sir.
Yes.
Okay. ठीक अछि. तो तापाई आपको किंतु सेठी ही facility रे ही maybe some poster or something लगाई देले हेबो की?
Madam, she wants.
Yes, ma'am.
Oh, yes, that will come. Madam, one thing I want to add, ma'am.
Yes.
As you told rightly, that in ICU, because they are using this hazmat suit, that is PPE, so there is no attendant of a patient. So actually, there is a problem about the human relationship. They are not connected. So here, the humanizing intensive care is also one aspect in management of ICU. They want to know what are the tasks they should do effectively in ICU. And there, this humanizing intensive care, that is giving emphasis on non-verbal communication with which they can be connected to the patient, is very important. And there is a module by the government of India also, already a module, giving psychosocial support to the patients. So they can be trained in that regard also.
Sure, thank you.
Ma'am, one thing.
Yes.
When the vaccination is also given, at that time, if government will provide any small leaflet or booklet like that, how the other people will prevent themselves, then it will be also very better. They will, yes, obviously people are knowing from YouTube and some like this, but still some people, they don't know internet and they are not using mobile.
Okay. Okay, sure.
Thank you, ma'am.
Thank you. Thank you. Anybody else wants to say something? Please feel free. We are not keeping any record of all this. It's okay. Please tell us. All right. So thank you very much. And with that, I hand you over to Sanjukta ji to complete the training.
Thank you, ma'am. I thank from the bottom of my heart, I thank all the faculty, wonderful training material, and for imparting this training. My thanks to all the participants also. I know the number is...
Hello, 2 queries were there.
Okay, we'll go to the question and answer session. We'll go to the question and answer.
Yes, ma'am.
Actually, what the one person has raised a question about antibiogram, right? Actually, antibiogram means it is related to antibiotics, that is the drug resistance, which say for particular organism, to which drug the organism susceptible. At any institute, they can make the list of it so that they can, the clinicians and pharmacists will be benefited. So, but here it is COVID-19, but there is another term actually, antibiogram, right? And that is actually related to HIV, antibiogram. So, the thing, and the second question, I think somebody has raised about intermittent pneumatic compression device, IPC. So this device is actually a inflatable sleeve, which is used on the calf, that is lower leg, and it inflates 30 to 60 seconds, again deflates. So it is just, it helps like milking the calf muscle so that blood flow will be better, circulation will be better, prevents clotting, prevents pulmonary embolism, right? And it is usually done on many occasions after surgery, stroke. So here in ICU, when they are not mobile, and to prevent any clotting and this DVT, deep vein thrombosis, it is used.
Still, sir, again, same question was asked by her that, but for antibiogram, it needs at least 1 year for analysis. So, can it possible for COVID-19 study analysis?
No. See, actually, antibiogram is related to antibiotic, okay? And we have very least number of actually antivirals. Rather, we are using monoclonal antibodies and all, right? So here, no question of, and again, antivirogram, this virus, that one is done for HIV only. Here, genotyping, phenotyping, etc., that is done by actually the institutes, and there they know the genetic sequence and all the mutations and all. So it cannot be done in every institute, right? They are doing their part. ILRF in Bhubaneswar, they are doing. RMRC, they are doing, I think. So in those institutes, they are doing the genetic sequencing and the variation of the genomic structure of the virus.
Sir, another question. What is cordon?
Sir is right. आपण माने जानी चंदी जे जो हमारा कोविड-19 वायरस अछि से frequently mutation करूची and genetic changes are happening and study तारो study जोटी होची जोटी genetic sequencing होची गोटे हला Institute of Life Science भुवनेश्वर आ गोटे हला RMRC भुवनेश्वर किंतु आमे sufficient number of antivirals use करू नाउ against this disease so that we can develop a antivirogram. There are problem because we have very limited use of antivirals. That only we are using only two antivirals, remdesivir and favipiravir. But jaha study hochi only dita jagare hochi and their results are not yet out. So amera limited knowledge. Kar abhi ebe periphery re bhi medical college re bhi knowledge nahi because the studies is not out. But I am very thankful that at least you know what is antibiogram, and you have asked it. Number one. Number two hela amara YouTube channel link ame apananko sangare group re share karchu. Chat re dekhantu, chat box re achi. Please, it is a request. Tike ei jo YouTube link अपना शेयर करंतु with everyone, your colleagues. हमारा जो आज जो ट्रेनिंग है जी टिके suitable है ला नहीं for others to attend. So टिके हमारा समझते colleague माने निश्चय ड्यूटी रे थिबे वार्ड रे बिजी थिबे. So हमें usually training 3 o'clock परे करू किंतु टाइम स्लॉट रा प्रॉब्लम जोगो हमको 11टा बेले करिया पडुची. तेनु गोटे रिक्वेस्ट YouTube लिंक अपना शेयर करिवे. हमें भी सब सीडीएमओ मान को पठेबो सब सुपरिटेंडेंट मान को पठेबो with a request to share with it everyone. Thank you. I again thank all the participants for joining with us. My thanks to the total team from Bimsar College of Nursing who have joined today and taken a lot of pains to prepare this training material, and above all to Professor Sadhu Charan Panda, my dear friend, who has helped us as well as all the nursing faculty, and this training has benefited all my nursing colleagues all over the state. I thank him from the bottom of my heart, sir, and thank you again for joining with us. Bala will say something.
Okay.
Sir, I think there is no question in the chat box.
Yes.
So can we close the meeting, sir?
Hey, all of you, Dr. Sanjukta ma'am. Okay, bye then.
42 ଜଣ